Hello, good afternoon, everyone. I'm Dr. Nikhil Patil. I'm a consultant intervention cardiologist. So, today, this video is both for the cardiologist and for the common public. We are going to discuss one case. This is the second case. Normally, whenever a heart attack case comes, there is always most of the time, there are only one blockage, and that artery we need open by putting a stent. But this is a very rare case where we have encountered a heart attack with both the arteries having 100% block, and the patient is surviving on only one artery, and the patient has arrested, and somehow we have taken him for angioplasty to save this patient. So let us discuss with the ECG showing a typical, this is for cardiologists, this is like a typical anterior wall MI where we are suspecting that one artery LAD will be blocked. It will be blocked like 100%. And let us go to the video. So we'll make it as full screen, and so this is the ECG. And now the first step goes is we do the angiography. So as you can see, the angiography, this is the one artery which is fairly where there is no that much significant blockages. This is he's surviving on only one artery. And then we'll discuss the second artery, which you can see it is like 100% block. I'll just scan it and I'll just show you. So this is like 100%. So basically it should flow like this. It should flow like this. So I opened this artery and anticipating that there will be only one blockages, but as you can see, this is the right side also it is blocked. As I'll just take it back, and the right side also it is showing 100% block, and there is a lot of clot happening over there, and it is not yet opened. So this is like 100%, and it should come like this. Okay, so this is a very tedious job for me, and the patient has been arrested, put on ventilator, and I have to open these both the arteries. So first artery I'm going to open, I'm ballooning it, and I have opened it the artery, and after ballooning I have stented the vessel. So one stent has been put over here. So this is the stent which I am putting, and then it is putting, and it has opened nicely. The artery has been opened very nicely, and I was very happy. But however, the patient is still I had still one more blockage to go. So once this artery was managed, this was opened nicely, I've gone to the right side arteries. Now see, the right side, the wire is not going properly because the blockage is so hard, and the artery is so tortuous. I'm not able to negotiate the artery. For fortunately I was able to do it with a balloon support, and these are all the skills which you have to use during doing the angioplasty. I'm ballooning the artery. There is a lot of thrombus. As you can see, the artery is unable to open, and I have to do extensive ballooning, and all the multiple balloons I have to take, multiple thrombus aspiration I have to do, and after that somewhat I have to give in the artery I have to give blood thinner medications and all. So it was a very tedious job, and fortunately some flow I can see, some flow of the arteries I can see. I have to take a multiple balloon for putting a stent, and I'm taking a stent to open that artery. And as you can see, as it is going, and this is a time sensitive matter. So here you have to put a artery and come out immediately. So after nicely putting the stent, there is a nice flow I'm able to achieve, and fortunately I'm able to get a very nice flow, as you can see. So the artery is opened, the one stent has been put, and the patient fortunately has survived, and he was put out of the ventilator. So these are some typical rare cases where the cardiologist has to be very skilled, very time sensitive, and he has to save the patient, and he has to take a thoughtful decision. So think fast, act fast, and you need a proper team also, and then we are able to save such patients. Yeah, thank you.